In Unit 14B.1, we'll be discussing therapies out of Chapter 17 in your textbook. So with therapies, we are talking in general about psychotherapies. Psychotherapies is an emotionally charged, confiding interaction between a trained therapist and someone who suffers from psychological difficulties. The best approach, and we mentioned it in our first video, is the eclectic approach to therapy. It's an approach to psychotherapy that, depending on the client's problems, uses techniques from various perspectives and forms of therapy to provide the best treatment. Now, therapy starts with psychoanalysis, right? Psychoanalysis comes from Freud analyzing his neurotic patients. Freud believed that patients' free association, resistance, dreams, and transferences, and the therapist's interpretation of them, released previously repressed feelings, allowing the patient to gain self-insight and to get over their neurosis. Use has rapidly decreased in recent years due to the growth of the application of the scientific method. Now, what is resistance? According to Freud, resistance is blocking from the consciousness any anxiety-laden material. So any of the defense mechanisms, for instance, so repression, regression, those. Now, when it comes to therapy, providing therapy, the psychoanalytic perspective believes in interpretation, as we've discussed. The analyst, or the psychoanalyst, or psychotherapist, noting supposed dream meanings and resistances and other significant behaviors in order to promote insight as to the causes of the disorder. Sometimes the psychologist might experience transference from the patient. Transference is when the patient transfers to the analysis any emotions that are linked with other relationships. So if a patient is suppressing sexual desires for someone, the patient actually might start to express those desires or transfer those desires to the therapist. The Humanistic Therapy focuses on client-centered therapy, as developed by Carl Rogers. This is where therapists use techniques like active listening within a session, where you genuinely accepting an empathetic environment to facilitate clients' growth. Active listening is the empathetic listening in which the listener echoes, restates, and clarifies things that the patient, or client would say. Behavior therapy. Behavior therapy is a therapy that applies learning principles to the elimination of unwanted behaviors. So, for example, counter-conditioning is the procedure that conditions new responses to stimuli that trigger unwanted behaviors. It includes systematic desensitization, also known as exposure therapy, and aversive conditioning. What kind of conditioning is this? It's operant conditioning. So systematic desensitization, what is it? It's a type of counter-conditioning that is where one associates a pleasant, relaxed state with gradually increasing anxiety-triggering stimuli. So if someone's really afraid of a dog, you're going to put them in a room where they feel comfortable, so that then you can bring them into closer and closer approximations to the dog so that they can get over their phobia or get over their fear. Aversive conditioning is a type of counter-conditioning that associates an unpleasant state with an unwanted behavior. You may have remembered this before when we were in states of consciousness and we talked about getting over alcohol addiction. You put the ipecac in the alcohol, you associate an unwanted state with an unwanted behavior, and over time, the behavior will diminish and go extinct. Here's an example of that. Getting closer and closer to the spider until they're no longer afraid of the spider. Not sure what happened here. Part of behavior therapy is the use of what's called the token economy. This is an operant conditioning procedure that rewards desired behavior. Like when I give you guys brains in class for speaking up, or if I give you guys if I give your team a bonus on the test for winning our Jeopardy game. That is a part of the token economy. Only applied to psychotherapy, where a patient exchanges a token of some sort that they've earned through exhibiting the desired behavior for various privileges or treats. So if I am in an anxiety arousing environment, but I don't demonstrate anxiety, then my therapist might give me a token, which then I can recoup for, I don't know, money or special privilege, special visitation privileges, like if I'm in an asylum or something like that. Then there's cognitive therapy. Cognitive therapy teaches people new, more adaptive ways of thinking and acting. It's based on the assumption that thoughts intervene between events and our emotional reactions. So if we change the way we think about something, we can change the way we react and behave in a given situation. So think about how learned helplessness and self-fulfilling prophecy might be a characteristic of this. Cognitive therapy we're right now in a cognitive revolution where cognitive therapies are being used more widely for psychological disorders than have been in the past, and they with some positive results. Man, my graphs are all screwed up. We might have to look at these in class. Then there's the cognitive behavioral therapy. This is a popular integrated therapy that combines cognitive therapy, changing self-defeating thinking, with behavior therapy, changing behavior through positive and negative rewards and punishments. Group therapies, like family therapies, treat the family as a system. It views an individual's unwanted behavior as influenced by or directed at other family members, and it attempts to guide family members toward positive relationships and improved communication. And that will lead us to our next unit, Unit 14B. What?